Okay, my name is Gloria Oku. I am the program coordinator for Project Pink Blue, and I'm also a breast cancer survivor. Yeah.
How has it been for this
It's not been easy. um,
Let's start by asking you when you were detected.
okay, yeah. I was diagnosed with breast cancer in 2017, March of 2017. Although I found out the lump sometime in 2016, and it took about 8 years of test, 8 months of tests and scans to get to a conclusion that the tumor in my left breast was cancerous. So in 2017, I also did a mastectomy. And after that mastectomy, I declined further treatments, because of so many factors. One of them being lack of access to funds to continue my treatments. And the other one being the fear of chemotherapy. People tell you, oh, chemo will kill you, don't do these treatments and all that. So for these two reasons, I delayed treatments for about 18 months. And then the cancer returned, came back again, and I tried herbal remedy, and then I came back. Finally, I went back to the hospital to do the regular cancer treatments. So I did my chemotherapy, I did radiotherapy, and I'm on a 5-year hormonal treatment as we speak. Yeah, so that's how the journey has been so far.
So how is the life now compared to that? Are you much better?
Yes, actually, I think mine wasn't caught that very late. So it wasn't like I was bedridden before I was diagnosed. So I've always been up and about. I've been able to manage myself well. But the truth is, managing cancer in Nigeria is difficult because the drugs are very expensive. There's this stigma also that comes with being diagnosed with breast cancer. Although I have been able to own my story, I tell my story, I'm comfortable with my story, I'm comfortable with my body, with who I am. And so the stigma doesn't get to me like it gets to some other people. So these factors, the stigma, the lack of access to money, lack of awareness, at the time I was diagnosed, I knew very little about cancer. So it delayed the actions I should have taken. So this contributes to cancer treatment being difficult. The facilities don't have enough machines, don't have enough drugs. So even though you might be on NHIS, the drugs might not be available at the hospital for you to even get. So there are so many issues around being a cancer patient and surviving cancer in Nigeria. But I'm pulling through one day at a time.
Good. In Nigeria today,
Yes,
so many people are still scared of this
yes,
disease called cancer.
yes,
Some resort to herbal medication,
yes,
some resort to prayers.
yes.
What is what are your words for such people?
Okay, as someone who has also told that part in the past, I told you I also tried herbal medication. In fact, I subjected myself to surgery in the hands of herbal practitioners, people that are not trained doctors. That is how desperate we can get. When you hear cancer, you get very desperate because it sounds like death. So what I want to tell those people is that honestly, I'm yet to see one person that has said to me, oh, I survived cancer because I took this and this herb. I've not seen. I've been searching myself to see so that can encourage us as some other people to go the herbal way. But I've not seen. But I've seen people who have done chemo, who have done radio, who have followed these other therapies, and they are doing well. So I think I advise people to choose treatments they can measure. Because when I was at the herbal center, they don't run tests. The only test they run is to check if there are lumps, and then they cut you open, pull out the lumps, and leave the wounds open and be treating them open like that. It could even get infected. So there are so many dangers that come with going to these untrained people to take care of a treatment. An ailment as serious as cancer. So what I always advise people: take treatments you can measure. So when you go to the hospital, you are doing chemo, you are running tests, concurrently with the chemo. They're checking your blood level, they're checking your kidney, they're checking your liver. Is everything fine? Can you do chemo this week? Is the lump shrinking? So all this information will guide them on what to give, on the kind of drugs to use, and on the quality of life the person can have.
I
Yes.
think treatment of cancer is capital intensive.
Yes, it
That
is.
you know.
Yes.
Can you give us an estimate of what you were spending per month when you were undergoing?
Okay. Mine. The cost of cancer depends on the type of cancer. So breast cancer, for instance, has different types, and some of them are more aggressive, and some of them are more, but some of them actually gulp money. Yeah, mine wasn't HER2 positive. I was HER2 negative. So it was less. My treatment was give or take 2 million from surgery to radiotherapy was about 2 million. Yes, but I've seen people that their treatment cost 10 million, 7 million. In fact, a friend of mine, her treatment is going to cost 20 million, 50,000. So it depends on the kind of cancer, the stage at which you presented, and how aggressive the cancer is.